Hello everyone. So for this week's video, I will be diving into treatment options and just a small snippet into what the treatment would actually look like. So a lot of the information that I'll be talking about today in this section will be pulled from a few scientific studies. I provided the links for these studies in the description below if you are curious to know more about it. And I would definitely encourage you to do so as well. So, based on these studies, we know that cognitive behavioral therapy, CBT, is currently the most efficacious in the treatment of anxiety disorders. Let's talk about the two most commonly used CBT treatment methods: cognitive therapy and exposure and response prevention. So once again, that's cognitive therapy and exposure and response prevention. In a nutshell, CBT is based on a model that links our thoughts, our behaviors, and our emotions together. So let's say we have a thought, right? And this thought evokes a certain emotion. And because we experience these emotions and these thoughts, it leads to a not so helpful behavior response, which then leads to another unhelpful thought. So as you can see, there's some cycle that's going on right now. So to make this a bit clearer, so for example, let's say I have thoughts of contracting COVID. And having these thoughts of contracting COVID results in me having some emotions of intense anxiety and intense fear. These intense emotions then drives me into a not so helpful behavior response of, let's say, I am not able to sleep at night. And then, I have even more thoughts of having a weaker immune system because of the lack of sleep, and it goes on and on and on, right? And you could probably tell by now how vicious of a cycle that this can become, especially when it comes along with intense emotions of anxiety and fear. It's no wonder that this cycle just keeps continuing. So the cognitive part of CBT identifies these unhelpful patterns of thinking. What I just gave the example for is what we call catastrophic thinking, right? The idea that we are jumping straight into the worst conclusions. Cognitive therapy can also include other things like challenging our thoughts that overestimate risk. These are just some examples of it. It doesn't include everything. And of course, each person's experience is a little bit different, which is why it's so important for you to work collaboratively and to work together with your therapist. So that's just the cognitive side of things, right? The behavioral side would include what we call exposure and response prevention. Now, this is exactly what it sounds like. You will work with your therapist and you gradually expose yourself to anxiety-provoking situations with increasing difficulty. So, for example, let's say reading or watching any news about COVID-19 causes me extreme anxiety. What exposure therapy will look like for me might kind of look like, let's say, then I will start off kind of watching 5 seconds of watching COVID-related news. Once I sit through the anxiety, then maybe the next time around I can do 10 seconds, and then a minute, and then 5 minutes. And it just goes on and on and on until I reach a point where I feel like, okay, my anxiety is not as intense anymore. So there are a few reasons why this works, and I will go through this in the next video as well. But this is just basically the first step, right? The second step is equally as important, where we look at preventing your normal behavior response to anxiety. So going back to the earlier example, this would include things like, let's say I would avoid reading or avoid watching any news about COVID, right? And these kinds of response can be problematic as well, because this is what we call avoidant behaviors or safety behaviors. This is also something that I'll cover in the next video. So that's all I have for today's video. I hope this was useful in some ways. Once again, there are links in the description below. I do encourage you to read more about it. I will talk more about the avoidant and safety behaviors in next week's video and why it's so important for us to be aware of these. So take care, everyone.